Hi, I'm Tyler Parker, and today I'm interviewing Jim Cybulski, who is the Chief Technology Officer at Axis Surgical, and he has been very gracious in being myself and Eric Minnick's tutor, who is our esteemed cameraman back there. And so I'm going to go ahead and start asking Jim some questions. To start out, can you tell us a little bit about your background?
Sure. So for my undergrad degree, I studied mechanical engineering and physics. This was in 1990, started in 1997, and this was at a school in Pennsylvania, Lehigh University. I studied my master's degree at MIT. This was 2002 through 2004. The research that I did there was related to nanotechnology field. I worked a little bit in industry, actually at Intel after that, and then I went back to get my PhD after leaving Intel. I was in 2005, I believe, to come to Stanford to study my PhD work. And the work I started doing here at Stanford was actually related to cooling of microprocessors using a liquid jet impingement. So I started working on that and gradually phased into a different project, which was more related to the biotechnology field. It was actually for sorting blood cells according to their response to an acoustic standing wave.
That's interesting.
Mm-hmm.
So that's kind of how you got into the field of biotechnology, and that was recently in the past year or so, because you changed projects again, right?
Right. So that's I was at Stanford for 3 years, and so it was about a year ago that I actually left the doctoral program and started a startup company. The company I'm working at now that you mentioned, Axis Surgical.
Right.
We're actually making a product for spine surgeries, and I could go into more.
Yeah, could you tell us a little bit more about what that is?
Yeah.
What it does?
Yeah. So basically, just to give a brief background on the need for some innovation in the spine surgeries, some of the pathologies in the spine are related to degeneration of the disc material that's between the vertebrae. So you have the vertebrae in between. There's a shock absorber kind of material. We call it intervertebral disc. And the outer layer of the intervertebral disc is called the annulus. The inner part is called the nucleus pulposus, or just nucleus. And for some procedures, such as a fusion or a partial disc replacement, full disc replacement, you're actually you need to go in and remove the inner part of the intervertebral disc, which is the nucleus. And you can do that from different approaches. For instance, some procedures for the spine are actually done through the stomach or the belly, and this is called the anterior approach. It could also come from a lateral, posterior lateral, or posterior approach. The type of procedures we're trying to enable are more minimally invasive approaches, which tend to be from the posterior or posterior lateral approaches.
Okay.
And so our device in particular, it's combining several different platforms. It has an integrated camera, CMOS camera that we're using, along with RF frequency, which we're using to accomplish the tissue dissection. So we're going in, and the ultimate goal is to remove the nucleus in a way that does not damage the surrounding tissue. And this is in preparation for these kind of procedures that I mentioned, like a fusion or a disc replacement.
Right.
And so doing that through a very small opening, and allowing the tissue to be removed efficiently to a doctor that's not very experienced with the tool, and in a manner that's safe for the patient. And in particular, the minimally invasive procedures are an advantage because they help to reduce the average length of stay for a patient since they're a less invasive approach. With the anterior approach, you tend to lose more blood, and there's generally more complications.
So it's typically a lot safer doing the posterior.
That's true. So I should also mention, doctors have had some resistance to adopting minimally invasive approaches generally, because while it can be safer for the patient or it can be, faster recovery time, there are some added dangers. In particular, you're operating in an area, that's very close to the spinal cord in addition to different nerve roots. So from the posterior lateral approaches, there's it's called a Caden's triangle that you're going through. There are nerve roots which exit at an angle from the spinal cord. There's the spinal cord itself, and then there's the bottom of the disc where you're operating in. And it forms kind of a triangle. You have to operate within that region, and so it confines, really the geometry of the probe that you're working with.
Right.
And so
there's a good bit of doctor hesitancy. Is it something kind of new, maybe? Is that why they're?
It is relatively new, and not all doctors. I think it's mostly younger doctors that are tending to adopt the newer methodologies, and so it's something that's other products are also targeting this area, but I think it's something that we can with the product that we're making we can really add to the field, because we're combining the 3 different platforms. I don't know if I mentioned all 3: the visualization, the dissection, and the articulation of the 3 platforms.
Okay. And the visualization, was that the cam you mentioned?
Right. We're integrating. It's a CMOS-based camera. Okay. The reason we're really choosing this for our platform is it has high-quality visualization, but it's also produced due to the mass production techniques we're using cell phones, for instance. Right. Due to the mass production, they can be produced very cheaply, and this allows us to make a device that's actually disposable.
Interesting. So I guess you kind of have a unique experience. I wanted you to maybe briefly tell us what it's like to work in a biotech startup, just given the times and the circumstances. Maybe give a word or two about that.
Yeah. Well, I think for myself, as I mentioned, I also had the opportunity of working at a very large company. I worked at Intel briefly, so I've seen kind of both sides of the spectrum, and I think just speaking to startups in general, not so much biotechnology, startups in general, I kind of think I fit into that. Personally, I fit into that environment very well, because I kind of like having different kinds of responsibilities and not a very structured kind of requirements on a day-to-day basis. Yeah. So that's I think that suits me pretty well. In terms of biotechnology kind of startup, I think, well, in general, the medical device industry tends to be more stable overall, because people always need, no matter what happens with the economy, they still need to take care of their health. So this is something which I think tends to be more stable, and it's we're currently in a position where we're trying to raise funds for our company, and we're definitely experiencing increased difficulty with raising funds considering the economy. I think that's true in general, but I feel there's moving forward, there's things are looking better, and there's more options in general for medical devices, in particular biotechnology in general.
Right. Okay, excellent. I think that's probably about a wrap. So we just want to thank you for answering our questions, and that's it.